Diastolic murmur is a murmur between S2 and S1, that is after the closure of aortic and pulmonary valves and before the closure of AV valves, atrioventricular valve. That is a diastolic period. There can be early diastolic murmur, mid diastolic murmur and late diastolic murmur. Early diastolic murmur occurs in aortic and pulmonary regurgitation, whereas mid diastolic murmur occurs in mitral stenosis. Late diastolic murmur, also called as Kerry-Combe murmur, occurs in rheumatic fever or rheumatic carditis. So in summary, diastolic murmur is a murmur which occurs during relaxation of the ventricle between S2 and S1, and early diastolic murmur occurs in AR and PR, regurgitation of aorta and pulmonary. Mid diastolic murmur occurs in mitral stenosis. Late diastolic murmur, Kerry-Combe murmur in rheumatic heart disease. Thank you.